Alright, so my name is Eloise Mikkonen, and I'm giving my crowdfunding seminar to update you on some of the things that I've done with your assistance through you supporting me. So I'll give a short presentation on Alzheimer's disease and then go since you guys have helped support me. So, I always like to start off with a little bit of humor. So, there's this very old picture from the internet. I may have Alzheimer's, but at least I don't have Alzheimer's. And although there is the funny side of things, Alzheimer's disease is a very serious disease, which currently does not have any positive prognosis or cures or even something that would slow the progression of the disease. So the initial symptoms are generally memory disturbances, which can be mistaken for age or stress-related problems, which then transgress to behavioral and psychological problems, and an inability to handle day-to-day activities. And of course, the later stages are much more severe. You become completely dependent on a caregiver. So, Alzheimer's disease is the most common neurodegenerative disease in the world. There is no cure, no effective treatment, and no successful preventative measures at this stage. There's been over 100 years of research, and it affects your memory and your learning abilities. There's more than 20 million people worldwide who are affected by the disease, and the onset is usually in the 60s or 70s, as in the age, 60 years of age. And the disease tends to last for about 7, even up to 15 years. So what we call neuropathology, or the brain lesions, are senile plaques, which are these ones here that I'm circling with the mouse, and the neurofibrillary tangles, which are these little triangle-shaped marks. And these are just, for simplicity's sake, known as plaques and tangles. And these are seen at autopsy and are basically they confirm an Alzheimer's diagnosis. And generally the plaques are seen in the cortex, which is your action part of the brain, and the tangles are seen primarily in the hippocampus, which is where your memory is managed. So not only are there these plaques and tangles, there are also a whole bunch of other things that can be seen in the brain in Alzheimer's disease, and that's brain atrophy, so a shrinkage of the brain. Obviously your neurons die, and there's a reduction in neurotransmitters, which are the little molecules that travel between your neurons to send signals, basically. And this is just a picture. The above picture shows a relatively normal brain, whereas the lower picture is, you can see it's much more shrunken, and that is an Alzheimer's disease brain. So causes of Alzheimer's disease, the familial form, which affects less than 1% of all Alzheimer's disease cases, is caused by direct mutations in genes. At this point, there isn't much you can do for those people, but they definitely know that they will end up with Alzheimer's disease because it runs in a dominant hereditary form. So if the parents have had it, then there is a high likelihood that you will have it. There is the sporadic form of Alzheimer's disease, which causes the majority, which I'll come to in a second, but Down syndrome patients also have the neuropathology, so the brain lesions seen in Alzheimer's disease. So then when we go back to the sporadic form of Alzheimer's disease, there are environmental factors. Multiple genes are thought to be involved. And of course, the most common risk factor is having this ApoE epsilon 4, which is a lipid transporter. and it increases your risk approximately 3 times if you have one of these genes, and if you've got 2 of them, then it increases your risk approximately 10 times of developing Alzheimer's. But of course, this is a risk, and not all Alzheimer's disease individuals have ApoE4, and of course there are other individuals who don't have ApoE4 who do get Alzheimer's. Some of the environmental factors include education, gender, lifestyle activities, and types of food and drinks that can be consumed over your lifestyle. So I won't go into too much detail, but this is basically how the amyloid precursor protein gets chopped up and turns into amyloid beta, which is the top right molecule with the A and the funny looking B. So it's thought that this amyloid beta, which is the cause of the plaques, it clumps up together in the brain and forms these plaques, and it's thought that the protein itself, amyloid beta, is involved in neuron growth, signaling copper and other metal transports and metabolism, and possibly even as an antioxidant or an antibiotic. Now, the reason why it clumps up is not really known, but it's thought that it's either related to an increased production of this protein or a decreased cleanup of the protein. And that's how we end up with plaques. As for the tangles, it's thought that there's an imbalance in the actions of a few proteins that cause it to become highly reactive, and they all kind of stick together and disrupt the functioning of the neurons, causing the neurons to die. So as for treatment, this is mainly focused nowadays on symptoms, and also uses cholinesterases, which basically affect the neurotransmitters, so the signaling in the brain, because these are found to be reduced in Alzheimer's patients. But research nowadays is focused on the removal of this amyloid beta, also reducing inflammation and enhancing age-stressed mechanisms to increase inflammation and to fight off that kind of, as your body ages, your ability to fight off diseases tends to not be as effective, and so the body may need a little bit of assistance. There's also some evidence that lipid modifying drugs, so those kind of drugs that help with high cholesterol, for example, may also help deal with the causes of Alzheimer's. So one of the big issues that I have is that there are a lot of problems with diagnosis of Alzheimer's disease and where the research is currently focused. So I guess the biggest problem in my mind is that the familial and sporadic forms of the disease are treated as the same disease. Quite often there is a mixed presence of different types of brain lesions, so it's not really a pure disease that you're looking at. Alzheimer's treatments, or at least the research, is focused on amyloid beta nowadays, which is a little concerning when we don't actually know what amyloid beta is supposed to do. And of course, there's the very important fact that ApoE4 is the highest risk factor for the disease. There are also variation in the initial symptoms, which are either visually focused or memory focused issues. And when people look at the cerebrospinal fluid, so in your spine, you can take a sample of the liquid that surrounds your brain. There are differences in the proteins even within Alzheimer's patients. So there are different types of Alzheimer's disease when you look at this. It's also very difficult to diagnose the early stages of Alzheimer's disease, and that's thought that it would be the most effective time to start treatment, but when you can't actually pinpoint when that is, it's very difficult to subject people to treatments. So a number of controversies that I think it's important to highlight is that these plaques are also found in non-demented individuals' brains, which has been a big part of my research. The majority of elderly people have both the plaques and the tangles, and can be quite normal considering their functionality. So there's a question of whether the plaques and tangles are actually a normal part of aging. The tangles associate better with dementia, the severity of dementia, whereas plaques do not. And I guess one of the questions that's been in the last decade or so is that maybe there's a specific type of amyloid beta that is the culprit, and other forms are less dangerous. I won't go into too much detail about that because that might confuse you all. As I previously mentioned, the nature of plaques are not understood, so we don't know whether they are a cleanup mechanism or whether they are just an actual bad thing to have in your brain. They might actually be good. So there are many different theories on what the cause of the disease is, but of course none of them have been proven to date. So some of the goals of my research following the crowdfunding campaign were to assess nutrient deficiency, and I can say that the samples have been sent off, waiting on the results so I can analyze them, and there's not really much more I can say about that because it's a slow process. The genome-wide association studies have been completed. I need to do a bit more further investigation on some of the things that have popped up from that research that have not been found in other Alzheimer's disease association studies. So this could suggest that there are other mechanisms at play when you consider just the brain lesions. So as I got more than 1 month's funding, I also had some stretch goals, which involved the stomach lining, and that's a project that's ongoing. I don't have any results from that yet because it's still ongoing and only some of the samples have been analysed. That's a similar case with the Helicobacter pylori test, but we've got an approximately 7% prevalence in the cases of the bacteria which is known to cause stomach ulcers. So that's quite on par as a normal prevalence of this bacteria in stomach tissue. My analysis of the blood type and whether it associates with anything related to Alzheimer's disease was not very successful. I didn't find anything, but it's something that I will reevaluate when the information comes in from the newer population of brains that I am assessing. The exercise data is in the assessment stage, and this is something that I will focus on in the new lining. And Jukka has asked, how many samples do you have to analyze, for example, with the stomach lining? So there were 150 individuals where we have stomach lining samples from. As for the, that would be the same also for the ulcer causing bacteria. They're the same samples that we're looking at. The blood type information is going to be a total number of the cases that we have both blood type information, which is coming from the genetic data, and also the data that we have the brain lesions from. So it's roughly, off the top of my head, around 500 cases. And with the new cohort will be about the same, maybe even a bit more. The exercise data, Yoko has just asked, are there variations of AD, of Alzheimer's, between nations and races? There are some variations. They say that in India they have a lower incidence of Alzheimer's disease, and the thinking behind that is perhaps that this spice, turmeric, has something to do with that. It has quite strong antioxidant activity, so it's thought that. But there are differences also in genes. So obviously, some populations, some races have a higher incidence of ApoE4, for example. I can't off the top of my head remember which ones, but there are differences between nations and races and things. To pop back to the exercise data, there is approximately 60% of all the cases from the newer Tampere sudden death series that have the surveys, the questionnaires we sent out answered, and so there will be 60% of 100 to 400 cases should give us some results from that. And finally, there was the herpes simplex virus study that was recently published, so we're kind of in step, well, completed phase 1 of our study on that, and I'll briefly go into a little more detail about that. So we had 584 brain tissue samples, and we found 11 of them positive for the herpes simplex virus. So this herpes simplex virus is what causes the common cold sore, and that's usually referred to as type 1, and type 2 generally causes the genital herpes. And we had, of those 11 positive, 10 were positive for the herpes simplex virus type 1, and 1 was positive for type 2. But this was all present in the brain. So 6 of those 11 that were positive for the virus in the brain had plaques, and 5 had tangles. But that wasn't really significant, and there were still many individuals that had plaques and or tangles but did not have the herpes simplex virus in their brain. So it strongly questions the involvement of the herpes simplex virus as a causative agent for Alzheimer's disease. But of course, it could just be that our samples were quite old, so they were collected in 2002 to 2004, so maybe this affected the low number of positive cases. But this is something that we will do in phase 2 of our study, where we will look at the newer brain population that I have, which will be another roughly 600 cases. And we can analyze that separately and then kind of pool all the data together. So maybe we have about 1,100 cases that we look at, which will hopefully give us some answers. So to finish up, I would just say that you can try and prevent Alzheimer's disease by looking after yourself. Eat foods that are high in antioxidants, fruits, nuts, fish, and the good spices such as turmeric. Red wine is also very good because it has high levels of antioxidants such as resveratrol. You need to keep your mind and your brain exercised, and of course yourself, so that you're nice and fit and healthy. And one of the favorite little sayings that I've found is this: adventure before dementia. So obviously, thank you for tuning in and listening. If you're interested, I've been writing a blog at the Wallacea, the crowdfunding website, which has now changed its name to Crowd.Science. So if you're interested, I've written about 5 blogs there now, and you can check them out. I'm on Twitter nowadays at Dr. Ella of Science. And if you have any questions, please feel free to ask, email. If you know me personally, you can call me and ask. And I'd like to thank you for tuning in and listening and supporting my research.